Welcome to the 2025 conversation with candidates for the District 11 Special Congressional Forum. We want to thank our partners and a thank you to each and every one of you watching and engaging. Now I am proud to introduce my son Connor, who will say a few words on the logistics, and then the amazing Lucy Bignell, who is our host.
My name is Connor Cummings. I am a self-advocate and proud to be autistic. Please remember that this is a sensory-friendly forum. This is not a debate. Talk about what you can and have done for individuals and families with disabilities. Please share your disability experiences and plans if elected. Please concentrate only on you. Thank you for respecting the sensory-friendly instructions. This is your opportunity to answer our questions and to hear our stories, not just today, but every day you are in office. To all of you watching, these candidates are here because they care. This is our opportunity to hear their disability platform, to help ensure that our representatives include us in the decision making, not just mentioned, but a seat at the table. Remember to always vote. Our voice matters. Your vote counts. Now here's Lucy to start the questions.
All right, we're excited to be here today with Supervisor James Walkinshaw, who's running in the special election for Virginia's 11th congressional seat. And I can't start us off without thanking folks for listening and remembering our work with Jerry Connolly, who held that seat for years and has always been a great listening ear to the disability community. And we look forward to whoever is elected to that seat being that same kind of listening ear, advocate, and champion for us. Now I'm going to put 15 minutes on my very official timer, and we'll start talking here with candidate Walkinshaw about his plans on disability issues. This is his time to use as he wants to go into as much depth on the questions we ask as he would like before we wrap up. And here we go. So welcome, candidate Walkinshaw. First, I'm going to dive in and ask about Medicaid. We have seen, and I imagine your office has heard a lot about plans to significantly cut Medicaid funding at the federal level. We know this is the primary means through which people with disabilities of all types get health care, as well as the primary funding stream for long-term care services, in-your-home services that keep folks out of institutions. These services are technically optional. And so there's a lot of stress and concern in our community right now about whether or not these funds will be cut in order to preserve Medicaid eligibility for others. Can you talk a little bit about your thoughts on protecting the life-saving services for folks with disabilities in light of the new federal landscape?
Well, thank you, Lucy and Connor and Sharon for helping to pull this together, and to the ARC for your incredible advocacy. And as you all know, I've been proud to work with the ARC over the years on Medicaid expansion to address the Medicaid waiver wait list in Virginia and in Fairfax. And the unfortunate reality is the cuts to Medicaid in the recent so-called big beautiful bill put Medicaid coverage at risk for 322,000 Virginians, including a lot of folks with disabilities. And those cuts could mean losing access not just to doctors and hospitals, but long-term care services that help folks with disabilities continue to live with dignity. So I'm going to support repealing the bill and preventing those cuts to Medicaid that the bill includes. And I think you're absolutely right that the added bureaucracy and red tape and needless paperwork that it will create will put states like Virginia, localities like Fairfax County in the position of trying to figure out how will we be able to afford all of this new red tape that the bill puts in place. And one way that states like Virginia have done that in the past is cutting services for folks with disabilities. So I'm going to fight against that. I'm hopeful that we can prevent some of these Medicaid cuts from the big beautiful bill from going into effect.
Thank you so much. And we'll move on to Social Security issues, things that we all hear a lot about. The SSI, or Supplemental Security Income Program, provides bare minimum income to folks whose disabilities make it impossible to work or work a significant amount. It's designed to pay for food and rent, but for perspective, the 2025 income amount at maximum is $967 a month. We are constantly hearing from our community that even when they are eligible, there are long delays in processing applications, wrongful denials of eligibility, and lots of concerns about people who are already at the lowest income bracket having blips in funding and care. What are your thoughts on addressing the system challenges that we're seeing in the Social Security program?
Well, first we have to address the asset limits, and those limits, which right now are $2,000 for an individual and $3,000 for a couple, haven't been updated since 1989. They were indexed to inflation. They'd be closer to $11,000 and $17,000 today. Congressman Connolly was a supporter of legislation, the SSI Savings Penalty Elimination Act, which would address those asset limits. So we have to address that. I think in terms of the way the program functions and works for the people who are eligible for it, we got to take a really hard look at what's taking place now with cuts to the Social Security Administration and its workforce. We know that thousands of federal workers at Social Security have been fired or forced out of their positions. They were short-staffed before the Trump administration, and now they're even more short-staffed. So we need a Social Security Administration that has the right people and the right technology to deliver the services and the benefits that people are eligible for. So I'll look to do both. Raise that savings, the asset limit, so more folks are eligible, and then make sure that Social Security is delivering the benefits for those people who are now eligible.
Such a great need. And we heard a powerful story this week about someone who needed $10,000 in ocular care and was told to save for it. And he said, but if I save for it, I lose the health insurance coverage for the
Yeah,
rest of the
right.
care.
That's right. Yeah, it's a catch-22. It doesn't make any sense.
It's a rough one. So we'll move on to home and community-based services. We mentioned this briefly in relation to the Medicaid program in general, talking about how this program provides on-the-job employment supports to help folks with disabilities of a big range find and keep work, help people get around their community, volunteer. Everything from dressing and rolling over in bed can be done through this program. But we know there are funding shortages in this program in a big way. Even prior to cuts to Medicaid, almost 800,000 people across the country and 15,000 in Virginia in specific are on waiting lists. We know they've got significant needs, but we don't have care to offer them. And this means unpaid caregivers, often family, leaving the workforce, having to quit or reduce hours to fill in gaps of care. And we see burnout, crises, and all kinds of other issues. How do you think Congress can tackle this national waiting list crisis and its implications in Virginia in specific?
Yeah, so you did a great job of highlighting the scope and scale of this challenge. 800,000 Americans, 15,000 Virginians, and this is an issue that at the local government level in Fairfax County we've done a lot of work on to try to work with our state partners. I think at the federal level, first we need to recognize, the American Rescue Plan temporarily boosted funding for home and community-based services, but we really need permanent investment in these programs. There's legislation in Congress, the Better Care, Better Jobs Act, which provides a 10% increase in the federal Medicaid match for home and community-based services. So it will incentivize and help state and local governments that want to expand access to these services and reduce those waiting lists. We also have to really work hard to right now protect, but ultimately expand community development block grants, which here in Northern Virginia and in Fairfax help fund a lot of those group homes and community-based services that can ultimately save money if your focus is on saving money, but also, foster independence and give folks the opportunity to live independently in their community. So we have to do both. We got to increase the federal match and protect and expand community development block grants to support those nonprofits that are helping folks live independently in our community.
Such a great point how good disability policy both is ethical and moral and saves dollars. So let's pivot toward the education system. More than 101,000 students are subjected to restraint and seclusion in school in this country annually. About 80% of those cases we know involve students who have already diagnosed disabilities, but there aren't federal laws banning the use of seclusion and restraint. The Keeping All Students Safe Act, patroned by Representative Beyer, would ban the practice of seclusion and restraint in all but very extreme cases. Would you look at supporting this or any other strategies you have to keep students, their peers, and our teachers safe?
I would support the Keeping All Students Safe Act, and Congressman Connolly was a supporter of that as well. But I think we also have to do more to promote and support our schools across the country in implementing positive behavioral interventions, trauma-informed approaches, strong accountability for how those interventions take place. We know in Fairfax County, we have thousands of students with disabilities who could benefit from those kind of programs. And if we're going to have positive behavioral interventions, truly trauma-informed approaches, our schools have to be well funded. And one of the threats that we face right now is the threat of loss of federal funding in our schools, the dismantling of the Department of Education. By the way, the Department of Education, a place where a lot of that kind of cutting edge research on those trauma-informed approaches and positive interventions has taken place, and that's all ground to a halt right now. So we have to do both. We have to pass legislation like the Keeping All Students Safe Act, and we have to push back against these cuts to schools across the country that will make it harder for schools to do the right thing.
We hope to see that in action. We also know people with disabilities leaving school have one of the highest rates of unemployment of any marginalized group, and the highest for multiply marginalized disabled individuals. Looking at some 2023 data from the Bureau of Labor and Statistics, about 22.5% of disabled adults were employed, compared to closer to 66% of non-disabled adults. We also know that number doesn't always show people with disabilities who are underemployed, only able to find work for a couple of hours a week, and those earning far less on average, despite having a similar educational background to peers. What policies are you thinking about to address the unemployment, underemployment, and wage gap felt in the disability community?
Yeah, you're absolutely right. I think the latest is a 40% employment gap compared to folks who don't have a disability. I think we start from the beginning. We start with real investment in programs like Head Start and early interventions in the classroom, in our schools to help build long-term skills and confidence. We need inclusion in our classrooms, and I think we do a good job of this in Fairfax, but can do more so that we reduce the stigma, right, for the community of folks who don't have a disability to be in the classroom with kids who might. So we reduce that stigma, and everybody's better prepared to work together. We need to strengthen, and this is federal government responsibility. We have to strengthen enforcement of ADA protections against discrimination in the workplace on work sites. We need to expand job training programs. The Workforce Innovation and Opportunity Act would help to do that and really promote integrated employment opportunities and make that the norm across the country. Because as more people experience it, it will become easier for employers to implement across the country.
We can't overstate the value of that inclusion. So I'll talk now a little bit about the direct caregiver shortage, and I'll give you the warning that I spent the morning on a tough phone call with an adult in Fairfax County who has an adult brother with autism, and she has lost 2 jobs and is about to lose her third because we pay $15 an hour on average for caregivers. And when they call out, she can't go to work. Nationwide, we see about a 50% annual turnover in these caregivers, which involves in massive loss of care and instability. And this workforce is disproportionately made up of women of color and immigrants that do really vital tasks to keep people safe in their communities, and to your earlier point, saves dollars compared to institutional or crisis care. We value their work, but we don't see that value in wages. We see folks working long hours, multiple jobs, sometimes resulting in falling asleep on the job to try and make ends meet. How do we get ahead of this national caregiver crisis to make sure anyone can age in place and stay in their community?
Yeah, that's right. We have by some measures 50% annual turnover among caregivers. And, we need to start with having a livable minimum wage for all workers, especially for caregivers across this country. There is legislation in Congress that I would look to co-sponsor, the Better Care, Better Jobs Act, that would specifically raise wages and help to stabilize the caregiver workforce. We also need to support those family caregivers, and if you're a family caregiver, that is a job. We need to support those folks with paid leave and tax credits and other resources. So we need to look at legislative solutions to support those folks. And we know in Virginia, we have real shortages in this area in terms of our workforce. We talked about it already, but it goes back to Medicaid and Medicaid funding that can help raise wages for caregivers as well. So we need to do all of the above: pass the Better Care, Better Jobs Act, support our family caregivers, and stop the cuts to Medicaid.
That would certainly have made this constituent this morning much happier. So we've got
Yeah.
about 1 minute left on the clock, and I'll leave it to you for any closing thoughts, issues that you wanted to talk about we didn't touch on today, those sorts of things. Take it away.
Well, I just want to thank the ARC again and let you all know that as I have on the Board of Supervisors, if I'm elected to Congress, I will have an open door and open ear policy. I hear you when you say nothing about us without us, and that will be my approach to dealing with these issues. It will be to learn from you and then fight alongside you for the policies and solutions that we need so that everybody in our community can live the life that they deserve.
That's the community we all want, right? Thank you so much for your time today. And we'll heed Connor's words and remember to always vote. Thanks so much for folks listening today and turning out for the special election. Have a great day.
Thank you all.